I'm Sheila, and I'm a full-time worker. I also go to Westwood College, and I'm going to school for criminal justice. I came down with diabetes. It's already been 13 years. I knew something was wrong because I wasn't myself. I went several times to the emergency room because I didn't have a doctor. I would end up at Cook County Hospital because I didn't have insurance, so I would have to go to the hospital, to the emergency room to see what's going on.
My name is Semeca Johnson. I'm a patient advocate here at the University of Chicago Hospitals. A patient advocate is someone who actually, I would like to say, is the fighter for the patient, someone who goes and finds resources. Sometimes the ER isn't the best way to go when you're trying to seek assistance or trying to manage a disease.
Went to the emergency room at night most of the time because I didn't have anybody to watch my children. Just waiting there was I just wanted to walk out a lot of times, but I knew I couldn't because I had to see a doctor. That's why I would go to the emergency room, and I would do that maybe twice a year.
So the reason why the wait periods are so long is because we see a lot of patients that have been in traumas, but we have to have priority for the patients that really need us at that time. So car accidents, congestive heart failures, patients that come in with chest pain, kids that have had seizures or asthma attacks. We don't want to turn anyone away from coming to the ER because when you are sick, yes, it is an emergency, but we don't just want to treat the symptoms. We want to make sure that after you leave the ER, that your symptoms are managed. And so we see a lot of patients with hypertension, diabetes, and things of that nature. Those diseases are better managed with a primary care physician instead of in the ER.
They will refer me to doctors, so I was going to Chicago Family Health Center. Every 3 months I have to see Dr. Schumann, so she can take my blood work and check my liver and my lipids and stuff like that. Dr. Schumann talks to me. She'll ask me questions, how's it going at home? And if I have any problems, then I can feel free to talk to her about stuff. I'm able to see several doctors for my diabetes because of my eyes, my teeth. We are able to see a nutritionist, which she explains to us what not to eat and how to eat to keep it under control. No, I don't have to run to the emergency room anymore because I have my medical home now.
We have 25 amazing healthcare centers in which they're all federally qualified. And so what that means for you is that if you have concerns about not being able to pay co-pays or being afraid that maybe the bill will be too high and you can't afford it, we are here to help you. We will work around that. We will find a way to make you comfortable, and so you don't have to worry about financial compensation when you go to our sites.
They would help people underinsured or uninsured. I didn't have money, but then I got on a sliding scale at the time. I explained to my sister that she's living with me right now. She lost her job to go there, and when she's going, and she's on a sliding scale, I explained to my son too to go there, and he's there now too because they don't have no insurance, and they will help them to get their medication, to see a doctor, and refer them to a hospital that will help them. Having a medical home now, it's good because now that I have diabetes and other medical issues, I don't need to go to the emergency room anymore because I have my regular doctor. I'm thankful for all the help out there.
My goal in life was always to give back to the community, and I feel that by connecting people to specialty care and primary care, that I'm actually making a difference. I love my job. I really love what I do.